Hi everybody, welcome to the CoolSculpting virtual open house from the Center for Plastic and Reconstructive Surgery. We're so glad that you could join us today. My name is Gina Thompson. I'm one of the CoolSculpting certified providers at the Center for Plastic and Reconstructive Surgery, and I'm here with Kathy and Heidi today. Kathy is our CoolSculpting master. She knows just a little bit more than me, but we work together. We both been to CoolSculpting University, which is where we got trained, wasn't it a wonderful time, Kathy,
It was
when we were
such
there?
a great experience. We learned so much there.
It's awesome. And we're also with Heidi, and Heidi is our nurse manager. Heidi and I have been here like 20 years plus a piece. We've worked together quite a bit, and Heidi is gracious enough to be here as our model. And most of us here have had CoolSculpting done, so we sort of practice what we preach, and she's been willing to let us utilize her photographs and talk a little bit about her experience. Are you happy to be here, Heidi?
I am very happy to be here.
So we're excited to be here today, and one of the reasons that we're doing our CoolSculpting open house virtually this time, and a lot of you have already been in to see us in person, but we know it's a busy time of year. I mean, it took us, we barely got the three of us in the same room today, so we're all very, very busy, so we appreciate you taking this little bit of time out of your day today to join us virtually. Please ask any questions along the way. We're happy to answer questions as well as demonstrate the treatment itself and talk to you a little bit about the CoolSculpting technology. So thank you for joining us. Okay, so we're going to talk a little bit about CoolSculpting in general. CoolSculpting is FDA cleared. It's a non-surgical procedure with little to no downtime. It's ideal for the midsection, under the chin, the arms, and the thighs. We ourselves at this practice have been practicing this for a little over 2 years. We've done hundreds of treatments. We've seen some really amazing results. One of the great things about CoolSculpting is that, as Kathy and I can attest to, when you go to their training, they're always learning new things, and we learn from the results that we get, what works, what doesn't work, and the technology evolves depending on what we see. So we're always learning new things. So fat is basically evenly distributed between the cells in our bodies. And this is just a before and after photo with an avatar showing before the CoolSculpting procedure and after the CoolSculpting procedure. One of the questions that people often ask is that, is the result permanent? And we say yes, absolutely. Once you kill off those fat cells are gone. And then what happens is that your body, if you gain a little bit of extra weight, let's say after the procedure, what's going to happen is that the weight that you gain will evenly distribute among the rest of the fat cells in the body. But definitely it's a permanent result. People like that it's a non-surgical option. We offer liposuction here as well, which some people prefer to have that treatment done, which we're happy to talk to you about that as well. But it's nice to have a non-surgical option. The procedure itself uses something called cryolipolysis, and cryolipolysis is something that happens when the fat cells are, we use this cooling to get the fat cells down to a very specific temperature, and then those fat cells die, and eventually they are eliminated through the body. How do we know that it works? We see up to a 25% of reduction in the area treated each time we treat the body. And we have seen evidence, not ourselves, but CoolSculpting in general has seen evidence of 9 years post-treatment, even with fluctuations in body weight, that permanence is still in existing. We have FDA clearance for 8 areas of the body, which is more than any other non-surgical fat reduction technologies. You can treat the submental area, the bra fat, the back fat, flanks, abdomen, the banana roll, which is behind the thighs here, the inner thighs, the outer thighs, and even the area right above the knee. Oh, and here's a picture of all of that. These are all of the areas that we have successfully treated. And there's been over 1 million treatments of CoolSculpting nationwide from the company. This has been done over and over and over again. Some really amazing results that we've seen. So the best results can be seen about 2 to 3 months after the treatment. And the reason for that is that because it is a more natural process, that when the fat cells die and the body naturally eliminates them from the body, it takes a little bit of time to see those benefits. So realistically, even if you have the treatment, so Heidi having her treatment done today, she's going to see her results in 2 to 3 months after the treatment. Some people a little bit sooner. And once the fat cells are gone, they're gone. And as long as you maintain your weight with normal diet and exercise, absolutely the long-term results should be sustainable over time. Why choose us? Well, because we're here, right? You have Gina and Kathy, CoolSculpting Masters. But in addition to that, we also have the latest technology. We have the next generation of CoolSculpting. And like I had mentioned before, CoolSculpting as a company keeps changing their technology in order to help with the demands of the patients and the results that they're seeing. So they continue to learn from the historic CoolSculpting treatments. So now we have shorter treatment times, as little as 35 minutes, all kinds of great applicators that help us address certain areas of the body that we couldn't address before. All of our CoolSculpting specialists, including Kathy and I, are highly trained, and we have 4 board-certified plastic surgeons who are here to help us out if there's anything that there's an issue with, and we love having them here. And you know, we think that we're gonna give you the best possible options. These are our surgeons: Dr. Beal, Dr. Sherrick, Dr. Eisenberg, and Dr. Hing. And as you can see, even Dr. Beal has had a treatment or a series of treatments himself. And he's perfectly comfortable, brought his laptop in and was doing some dictation and some notes while he was here that day. He was catching up. And here's a picture of Dr. Eisenberg taking a nap on the treatment day. So certainly it's pretty comfortable if you can actually take a nap during your treatment. We actually hear a lot of our clients will tell us that we'll turn off the lights and get you totally comfortable, and people will actually rest, because most of us running around doing a million things, we don't often have that time. So we welcome you to take a little bit of a nap if that works for you. Actually, a lot of you have submitted some questions. We're going to be answering those before we're done, so keep them coming. If we do not answer your questions live on camera today, we will get back with you via Facebook or email, or however you connected with us. We will answer your questions, and of course, you're always welcome to come in and have a complimentary one-on-one consultation with Kathy, myself, or any of our other CoolSculpting providers, and we can evaluate you very specifically to see if you're a good candidate for treatment. And if you want to be eligible for our prize drawing, because we are offering a free treatment, please do what we ask, which is to ask a question or come in for a consultation between now and December 14th, and we would love to see you. So I'm sure one of the big questions that everybody wants to know is, what are the results of what you see with CoolSculpting? And the results that we're going to show you now are our actual results. Certainly CoolSculpting has tons and tons of results on their website, but we're very proud to share the results that we've specifically seen ourselves. This is an example of the abdomen before and after. This is after a 90-day, after the 90-day treatment, and this is a 27-year-old woman, and you can see the flatness in her tummy in the after picture. And this is a 20-year-old woman after 90 days as well. And as you can see, definitely a big difference in the volume in her abdomen. Wonderful results there. This one I think is really amazing too. This is the upper and lower abdomen. Now this person did have 2 treatments, and this is after 90 days after the second treatment, and she's 65 years old. I mean, this is a huge, huge change in terms of the look of her abdomen and the way that she fits into clothing now. Here's an example of the back bra and upper flanks. This is also 2 treatments after 90 days. This is a 61-year-old woman, and you can really see the difference in the crease that's here and no longer. One of the things to mention too is, how many treatments do you need in order to see successful results? And honestly, the answer is it depends. It depends on the area of the body. It also depends on your body's natural response to the treatment. And when you think about it, you're reducing the volume by 25% in the area that you treat every time that you treat it. So if you have larger volume, you're probably going to notice more results more quickly, even though it's still relative to someone who doesn't have as much fat. And if you think about it, if you have a glass of water and you reduce that by 20% versus by 40%, that second treatment, let's say representing that 40% reduction, you're really going to notice it more. Most people need 2 to 3 treatments is what we've seen, and we usually schedule them between 60 and 90 days apart depending on the person. This is that same patient. This is just a different view. Again, you can see the difference in the before and after. And this is a male patient in the lower flanks, 1 treatment, 60 days. And yes, we do treat men and women. Everybody's included and can see benefits for sure. And we do have more before and afters on our website. So if you are curious and would like to see more pictures, we're happy to show that to you. All right, so now we're going to talk a little bit about what happened before Heidi got to where she is right now. And there's a little bit of a process, and again, this is partly what we learn in our training. We want to make sure that we properly evaluate our patients, that we take before and after pictures, that we assess you in an appropriate way. So this is just earlier today, right before Heidi's treatment. And in this picture here, we're demonstrating how we're taking the photographs. You can actually see too, we only take the photographs of just the area that we're treating. So your face is not going to be in any photographs unless it's your submental area. And certainly we don't share any of those photographs unless we get appropriate consents from you. That's very important to us. In this picture here, what Kathy is doing is she's actually kind of squeezing the area of fat to see that she's getting this just right. And this is something that I thought was really interesting at CoolSculpting University, that you are really trying to figure out where the fat pad begins and ends, how the fat pad lies. And once we figure that out, then we know where the applicator is going to fit to give you the best results. So here's Kathy again, and she's using a template, and the template is the same length as the applicator, and she's putting that on the body, and then we're marking the body. So we do this all beforehand, and so we get the applicator to be put on exactly where we want it once we've measured with the templates, and we kind of follow a very specific protocol. And here Kathy is again kind of marking exactly where that should be. And then we go back in and we make sure, and you can see Kathy's kind of like, all right, is this how it's working out? We'll go over it with you to make sure that that's appropriate. One of the things to mention also with CoolSculpting is that CoolSculpting works on subcutaneous fat, not visceral fat. And the difference between the two is subcutaneous fat is the fat that sits more on the surface that you can squeeze. We laugh and say, if you can squeeze it, we can freeze it. So, but it is true because the deeper fat, so for example, someone who has like a really bigger abdomen and it's hard and you can kind of hit it that way. If we can't grab that tissue, that means the fat is underneath the organs and it's more visceral fat. We cannot reach that area, nor could you reach that area with liposuction. So that kind of fat can only be addressed with diet and exercise and other things. We can only deal with the fat that's on the surface that we can grab because we need to get it into the applicator so that it will respond to the cryolipolysis. So that's a really important part of the assessment process that we will do at the consultation even before you come in for the day of treatment. Now this part here, Kathy, I'm going to let you talk about this. So we're kind of wiping down the area.
So we wipe down the area, it's not really meant to clean the area, it's meant to leave an ingredient on the skin, and what that does is it protects your skin against frostbite. So we definitely want to keep your skin nice and safe. So this is the first step that we would do. We would just take this wipe the entire area for a minute, and then after this, if you want to slide that up, the next step in protecting the skin is putting this slimy, gooey gel pad on. It is a little cold, it's a little slimy, but we put that on, we get all the air bubbles and creases out of it. It's the next layer of protection. So we definitely want to keep your skin nice and safe. So after we put, this is a picture of the gel pad once it's on. You can see that it's a little wet and slimy. But that's the last step we use before we put the actual applicator on. We'll turn the power on, put that applicator on the body. The patient will feel that tissue just suck right up into the applicator. It can feel a little pinchy, it can feel a little stingy as we first put it on, but that subsides after just a minute. So yeah, we put that on.
How does that feel for you, Heidi?
It's just a little tender in the beginning, but it's completely tolerable.
Yeah, it's not bad.
And it's just for a few seconds and it goes away.
Yeah. It does do a nice tissue grab. It just pulls it right into that applicator, right to the back of it. So that's why you get that pinching sensation. So with Heidi in this picture, we had her stand. I put the applicator on her. I wrapped a strap around her to help secure it. I put this boppy around her waist, and then we had her sit down. So this is after she was seated. And this is Heidi just enjoying her time during her treatment. So you can see it's not terribly uncomfortable where you can't work or watch a movie or sleep. People come in and they love to have that downtime. So this particular treatment is 35 minutes. After that 35 minutes, which we are getting close to, we will take that applicator off and do a 2-minute manual massage. That massage damages more fat cells. By getting in there and just manipulating that area, we can kill more fat cells, so your results are enhanced. So it's not too bad, is it?
No.
Yeah. So after this treatment, we're going to treat the other side, and hopefully we'll give her that nice hourglass shape.
So Heidi, you've had treatments before, and you've actually gotten work done, right?
Oh yeah. Yes.
We kind of laugh, like we can have our headsets on, so you might get a phone call, or you might call us and someone might answer. We could be having a CoolSculpting treatment while we're answering the phone, or catching up on chart notes, or other things.
Or people coming and talk with me.
Or people coming in and having a little curbside chat.
Yeah.
But certainly our patients bring in their laptop computers, they have their cell phones, they can charge them here. Maybe we do provide snacks and water for you, but certainly you can bring your own. We ask you to dress comfortably, just kind of like a tank top or whatever, because that slimy, ooey gooey gel pad that we talked about that's important to protect you can get on your clothing. So we ask you to dress comfortably. We have blankets, we have a robe, we have other things to keep you comfortable while you're here. We actually have iPads too, and we have a Netflix account, so you can catch up on your favorite series or binge watch, or literally take a nap if that's what you prefer. And the beeper just went off. That was actually really good timing. So Kathy carries this beeper along with her, or I do, whoever's treating the patient. So we sort of laugh, like if Heidi were to drop her phone, or she needed a sip of water, or even wanted a cup of coffee, she can page us anytime with her little pager.
She can push this call button.
And then
it beeps us.
And we get a page, and then we can come in and take care of you, because we want you to sit. You can move, but we want you to be relatively still, because we don't want that applicator coming off your body. So when the beeper goes off this time, it's to indicate that there's a few minutes left in the treatment. So Kathy's going to get ready to remove the applicator and do the 2-minute massage. So we're going to do that, but in the meantime, we're going to answer just a couple of questions that have come in. And so, is this procedure painful? I'm going to let Heidi answer that question.
No, this procedure is not painful, and actually even after the procedure, I have never had any discomfort after in the area. So I highly recommend it. It's easy. I can go right back to work. I don't have any restrictions really when I go home. And the only really thing that might be noted is that maybe it looks like you might have a little hickey in that area, but actually that subsides after a day or so.
Yeah, just a couple of days.
And it has never hurt.
That's
really
good.
the only part that I feel is a little tender is when it's first put on, and that's it. So
I find that the massage is a little bit uncomfortable, but again, I think it varies from person to person, and I find that it also is a little bit tender, but a tenderness that you don't even recognize until you actually put pressure on it. So you'll forget about it, and then if you accidentally sit down and, just for a couple of days or so, that it's just a tiny bit tender. One of the other questions, is this meant to help people who are of normal weight and have some stubborn areas of fat, or can it help people who are overweight or obese? So what I would say to that is it can help anybody at sort of any stage of their weight loss, or if they're very happy with their weight. This is not a weight loss program. this is not indicated for weight loss. It literally is removing stubborn fat cells in very specific areas. We do have patients who will say that after having a CoolSculpting treatment that they'll notice that it motivates them to maybe get into a weight loss program. But certainly the treatment itself is not indicated for weight loss specifically. We've been very successful at treating people who are very happy with their weight and just have stubborn pockets of fat. And we also have had great results with people who would be considered 25 to 50 pounds over their ideal weight, and it's effective for those people as well. Unlike something like a tummy tuck where the doctors might say, we want you to be at your ideal goal weight, that is not necessarily the case here. You can do it any time in your weight loss journey. Okay, so now, actually let's take a closer look at what's going on with Kathy here and Heidi. And so the timer is done, and we're going to remove the CoolSculpting applicator. We want you to take a closer look at what Heidi's skin looks like.
So I'll take this gel pad off. So the area is just very red and very red and very cold. It's not painful. It's usually very numb at this point. So I am going to do a 2-minute massage. And again, what that does is it kills more fat cells. Do we have some more questions? How does it feel?
It doesn't hurt at all. If anything, I think it feels numb.
Oh,
okay.
Yeah, just because it's cool.
Yep.
so
Usually,
much.
what happens after the suction happens and we're doing the application, it gets. I feel like it gets cold. It gets really cold.
Yes.
Your skin is protected, but you'll feel that coldness, and then it kind of goes numb, so you don't feel much of anything. And then we're doing the 2-minute massage, which I feel like is a little uncomfortable. Heidi's a rock star because it doesn't bother her at all. Which I think is fantastic. And you can see that the skin is red, but that's going to go down within about an hour or so.
Yeah.
So one of the other questions is, how does it work and how does it affect your organs if you do the stomach? And part of that answer to that question we answered a little bit earlier, in that we're not treating the visceral fat that's underneath. We are only treating what's on the surface. So your organs are not at all involved in any of this. And actually, none of the other tissue is either. There's been a lot of research in the past that it does not affect anything but the fat cells. So because of that, we're only addressing the fat. And again, you might have a little tingling, a little numbness. It might feel a little bit weird, almost like when your foot's asleep and it's kind of coming back. But these fat cells are the only cells that are permanently affected by this treatment. We answered the question, is it painful? The other question is, how many treatments does a person need to see maximum results, and how long does the treatment last? The treatments themselves last, this is 35 minutes per area. So if Heidi's having more than one area, it's 35 minutes times that number, and a little bit of extra time for changing the applicator over in between if you need to use the restroom, grab a sip of water, that kind of a thing. So there are times where people are here most of the day with us, and we make you comfortable, we give you snacks. We definitely want it. We make it a good day. You get to spend the day with us, and we love to have you. What else do we have here? How many treatments? Usually between 2 and 3 treatments per area is what we recommend, and the results absolutely are permanent. Once those fat cells are gone, they're gone. Every time we do an application, we're killing off 25% of the fat cells in that specific area. So what's next, Kathy?
Yeah, the massage is done. As you can see, it is still a little red. It's still very cold. Does it hurt? Does it?
No.
Yeah, most people are just numb. Yeah. And that numbness can last for a few hours, a few days, some people even get it for a few weeks, and that's normal. So what we're going to do next is we'll get her standing back up. We'll make sure that area is nice and clean and goo-free, and then we'll just start on the other side of her body. We'll just do the other love handle. So.
Well, thank you so much for joining us at our virtual open house. Thank you, Heidi, for being willing to be on camera. And Kathy, who's our master cool sculptor. And if you do want to come in for a consultation, we're happy to see you. Please continue to ask us questions throughout the day. And again, if they weren't answered on camera, we'll make sure that we'll get to them soon. And we thank you for your time.
Yes.